Hi, this is Rich Sanders with Southern Health Lawyers, and this is the Health Law News Nugget for March 20th, 2018. Well, as promised in our spring break edition of the Health Law News Nugget, tonight we're going to talk about the CMS set of proposals that CMS Administrator Seema Verma announced at the HIMSS conference on March 6th. This is a wide-ranging set of proposals that affect not only Medicare policy, but every other American in their use of information as well. It focuses on three things. The first is increasing patient access and control to their information. The second is increasing patient choice of competing providers and increasing competition. And then the third is changing Medicare conditions of participation on providers to increase competition and efficiency. All of this on the heels of an executive order that President Trump signed in October of 2017. Now, the first part is probably the biggest focus of the administrator's speech at HIMSS and really is going to have the biggest impact, I think, on Americans' day-to-day experience with their health information. Part one is a new program called My Health E-Data. My Health E-Data is going to be basically a federally sponsored personal health record to allow folks to access and control the movement of their medical information between providers. And CMS's theory is increased competition. For Medicare enrollees specifically, Medicare Blue Button 2.0 combines claims data from Medicare Parts A, B, and D, so that ultimately the information of 53 million Americans is combined into this database that will ultimately, CMS says, make it easier for folks to access care and have care delivered to them who are participants in the Medicare program. Now, CMS also puts emphasis on increasing patient choice and the ability to access healthcare through CMS programs. That is, among other proposals, that's going to be addressed by the streamlining of the Meaningful Use program and changing standards under the QPP program to increase interoperability. Finally, CMS, as part of its proposals on changing the Medicare conditions of participation, there are four subcategories of that. Probably most important to frequent viewers of the Health Law News Nugget is that CMS promises to streamline E&M coding and decrease documentation requirements. Believe it or not, I've heard this many times from our clients over the years. CMS is on board with trying to decrease documentation so that providers can spend more time with their patients. We'll see how all of these broad-based proposals actually come into federal rules later on in the year, but it's a great start in trying to decrease some of the barriers that patients face in moving between providers in our country and the regulatory restrictions that providers face as they try and take care of their patients. Thanks for watching the Health Law News Nugget. There was a record week last week. We crossed 1,000 viewers of our weekly news edition focusing on the business and politics of the healthcare industry. Thanks for watching, and we'll look forward to seeing you again next week. I'm Rich Sanders with the Southern Health Lawyers.